Delta Sigma Theta Sorority Incorporated will be filming, recording, and photographing this event for use in Delta promotional videos, photography, advertisements, social media platforms, web pages, and other future Delta events as the case may be. Via continued participation in and by continuing to remain logged into this event, hereby acknowledges that participant may be photographed, filmed, or otherwise recorded while on the premises of the event. Grants Delta, its successors, assigns, and licensees irrevocable consent to include participants' name, likeness, photographic image, mannerisms, and voice or other recording in the production or for exploitation for any purpose whatsoever in any and all media now known or hereafter devised throughout the universe in perpetuity without compensation and or credit. Represents, warrants, and agrees that Delta holds and shall forever hold all display, publication, and ownership rights, licenses, and privileges to any and all media, whether in law or in equity, which may be ascertained, registered, or in any way utilized with respect thereto, and waives, releases, and transfer, as the case may be, any and all such rights, whether in law or equity, as may be necessary or required to effectuate Delta's establishment of ownership. Participant further agrees to abide by and comply with any and all terms of use and or additional participation rules as applicable and specified during relevant sections of the program, and acknowledges, understands, and agrees that violation of such participation rules shall result in legal recourse and disciplinary action.
Good evening, everyone. My name is Nakia Carter. I'm a member of Fairfax County Alumni Chapter and coordinator of the Physical and Mental Health Committee. On behalf of the committee, I warmly welcome you to our diabetes education session tonight. It is our hope that you leave tonight feeling empowered with the information presented to effectively manage diabetes. Before we get started, would you please take a moment to sign in through the chat so that we can track our attendance for tonight. We'll also have a live Q&A session later, and you're also able to post your questions in the chat as well. To get the program started, I would like to hand it off to committee member Natalia Bishop, who will introduce our guest speaker for tonight.
Thank you, Sir Nikita Carter. Good evening, everyone. I would like to introduce you to our distinguished speaker, Angela Jen Meadow. What can I tell you about Angela? Angela has revolutionized the field of health and nutrition by developing innovative ways to help patients achieve optimal wellness. With over 20 years of experience as a registered dietitian, Angela is an expert in assisting patients with chronic disease throughout their journey of prevention, treatment, and management. With her evidence-based assessment, care plans, and support, she's achieved an impressive clinical outcomes, such as a decrease of greater than 2% in A1C, 15% lower blood lipids, and greater than 10 millimeters of mercury, lower blood pressure, which are more effective than medication alone. Angela's exceptional reputation for patient training has improved the quality of life of countless clients. As a community change agent, Angela is committed to promoting social equality in the health profession. Her appointment as an advisory board president for Morgan State University's Food and Nutrition Science program is a testament to her dedication to promoting nutrition careers for minority students. Angela is also a scientific advisor for the Grain Foods Foundation and diabetes expert. And her appointment to the Greater Baltimore Community Leadership Board for the American Diabetes Association in 2023 was a testament to her expertise in the field. Angela graduated with honors from Morgan State University with a Bachelor of Science in Food and Nutrition, and she completed her nursing program later in her career with honors. As a media expert and a former national spokeswoman for Academy of Nutrition and Dietetics, Angela has been featured in numerous publications. That includes Marie Claire, Food Network, Everyday Living, Prevention, Better Homes and Gardens, Essence, and Dr. Oz. Angela's vast experience and expertise make her an exceptional leader in the field of health and nutrition, and her contribution to the field are invaluable. Without further ado, Miss Angela Jen Meadows, thank you and enjoy the information session.
Good evening, everyone, and I'm so excited to be here with you this evening. I really want to make sure that I make this as personable as possible, and if you have questions along the way, please place them in the chat, and I'll make sure that I answer them. I will start my presentation. Yes, you heard about me. I'm Angela Meadow. I'm a registered dietitian and a registered nurse and a certified diabetes and care and education specialist. I have seen patients and followed them for over many years, and some of my clients I had over 16 years helping them manage their diabetes. I hope you can see my presentation. What I want to make sure that you know is finding your sweet spot with living with diabetes. And I worked at many medical institutions, but also I have had a private practice along my way. And so I want to first go over the different types of diabetes. And so the different types of diabetes, there's type 1, there's type 2, there's even gestational, and there is we call LADA, that's a late onset type 1. So type 1 diabetes is when your pancreas makes little to no insulin. You require insulin to survive. Whereas type 2 diabetes is your cells do not use the insulin well, and your ability for your pancreas makes little insulin, it makes some insulin, but it actually decreases over the years. With gestational diabetes only occurs during pregnancy, and it's because of the placenta that's creating insulin resistance. And then the last kind of diabetes, and we don't see it very often, but it does happen. It's a late onset type 1 diabetes, and that late onset type 1 diabetes can happen later on in life. For some are late, you may be in your 50s, you may be in your 40s, you may be in your 60s, but you require insulin to survive. And so, oftentimes, as minorities, you're often misdiagnosed with type 2 diabetes automatically. And then later on, your doctor will come back and say, hey, you actually have type 1 diabetes. So, what is a touch of diabetes? So, diabetes, when you're diagnosed with diabetes, you can be diagnosed with an A1C of 6.5 or higher. But there is a small window that's in between having diabetes. I always say it's your one step in the door, and that is considered prediabetes. Prediabetes can be diagnosed with an A1C of 5.7 to 6.4. 1 and 2, so it used to be 1 and 3, that number continues to grow of people that actually have prediabetes, especially in the United States. There's 1 in 5 right now that have diabetes, type 2 diabetes, and that's the most common. 95% of the population actually have type 2 diabetes. And they will even say 90 to 95, and then there will be that 10% of the population that has type 1 diabetes. A normal A1C is 5.6 or lower. And that's what your A1C should range between 4.9 and 5.6. That's a normal A1C. And don't allow your doctor just to say, oh, your A1C is just a little higher, come back in a year. No, this is your time to actually do something about it. Prediabetes is a time where actually heart disease starts to set in. And we know that you have about 5 to 10 years before you're developed type 2 diabetes if you don't do anything about it. So, type 2 diabetes actually may change over time. So I will tell you, and I'll be completely open with you. I always talk about my family because I love them. But I lived in a family that everybody kind of had diabetes. So both my grandmothers had diabetes. My grandfather got diabetes when he turned 86. My dad had diabetes. My aunt that lives with me, she has diabetes. So it really runs very closely in my family. But I do know that diabetes changes over time. When you're first diagnosed with diabetes, you may manage your diabetes with just diet and exercise. And then the next thing that we would do would be oral medication. After oral medication, they may try an injectable. There's a lot of injectables out there. I'm not going to talk about any brand names, but there are a lot out there. And then the other treatment would be insulin. Just because you are on pills doesn't mean your diabetes is better off than somebody on insulin. It's all about the tools we need to help you better manage your diabetes. So, with lifestyle changes, that really is the key. Lifestyle changes alone can help you manage your diabetes. It is the foundation of really managing it. And when I say lifestyle, I'm talking about eating well and staying active. If I could bottle up exercise, I would because it actually helps you lower your A1C naturally. But there are other pillars that come along with diabetes care: medication, monitoring your blood sugar, physical activity, and also education. People don't take advantage of education. So, Medicare beneficiaries take about 5% of the opportunity for them to take advantage of diabetes self management education. And commercial insurance, you only take about 6.4%. But we know that education alone can help you lower your A1C and manage your diabetes better. So when it comes to monitoring, and I know I have patients that I see and they say, why do I have to check my blood sugar? I go to the doctor every 3 to 6 months. Well, I'll tell you, monitoring your blood sugar allows you to have self control. You are in control of your diabetes, nobody else is. Not the doctor, not your family members, it is you. And so, for you to be better in control, what you have to do is really monitor to see what's going on. So, you need to know why I'm going to monitor. You need to know your targets. You also should know to understand highs and lows, and I'll talk about that. You want to know and understand how food affects your blood sugar because that is how you'll actually make changes to your eating habits if you know how food's affecting your blood sugar. You'll understand how activity affects your blood sugar and if you're taking the right amount of medication. So you will not know any of these things if you're not monitoring your blood sugar. So if you're living with type 2 diabetes or type 1 diabetes, your blood sugar before you eat should be between 80 and 130. That's where we like it to be. That's where that sweet spot is, where we want your blood sugar to be before you eat. 2 hours after, it really should be less than 180. And then your A1C should stay at 7% or below. 7% or below is for you to prevent complications. Complications can range from, of course, they affect you from head to toe. They can range from losing your eyesight. We call that retinopathy. It can heart disease, that's the number one killer of people with diabetes. To kidney failure, we call that nephropathy, to even amputations. All these different things can occur when your A1C is elevated. So you say, okay, now I got to check my blood sugar. What am I looking for? Well, your insurance actually predicts what meter you will use, but there are a lot of things. I see a lot on social media. People are wearing sensors on their own, trying to see what their blood sugars are, but your insurance will show you exactly what meter is covered. You also want to look for the size and shape because that's also important. The steps to check your blood sugar, and a diabetes educator actually will help you with all this. The size of the print of the meter and those readings, that's important because if you're having issues with seeing, that will be something that you want to make sure you have a large print meter. a computer download or app, an app to your phone. So a lot of my patients really look for meters that have apps because they're able to just easily see their readings, but not only that, send it to their providers. So there are so many traditional meters out there for checking your blood sugar. And these traditional meters they range from different types and they're all different brands. Now, they also are available over the counter. You do not need a prescription for them. You can actually purchase one if you really need one. The cheapest one, I will tell you, that really that if you are in need for a meter or for anybody that loses their meter and needs another one, would be from Walmart. Rely on makes wonderful products that you're able to buy a meter and test strips for about $25, $30. I will tell you, test strips are what cost the most. They are $1 a strip. And so when people lose their testing supplies, they really are really worked up about it because they are very expensive. So this is traditional meters. This is the one you prick your finger, you get some blood, and then you put it on a test strip and wait for that reading to come up. But I will tell you, everybody's wearing them, and you should talk to your doctor about it if you don't have one. And that is continuous glucose monitoring. So, self monitoring of blood glucose really is important because you need to know where your blood sugar is in the moment. That's what meters do. But with continuous glucose monitoring, it shows you readings every 5 minutes. And so it gives you direction of where your blood sugar is actually going and why, and it tells you what's going on. So you'll see this is a pattern right here where the finger sticks are only in that moment of time. Whereas when you have a continuous glucose monitor, it allows you to see wherever your blood sugar is. If you had eaten a meal, or if you went exercising, or if you were stressed out, or on your cycle, all that shows it. And it tells you your target zone, especially the time of day. So, continuous glucose monitors will be something you'll see more of. And you're not limited to getting one because of your age. I will tell you, my aunt wears one. She's 79. She loves her continuous glucose monitor. I would not take it away from her. And she actually pays out of pocket for it. And the reason why I say that is because um, having a continuous glucose monitor based off insurance can be based off what you're taking for your diabetes if they want to cover it. But it is still is available and is a tool that you can use to better manage your blood sugar. So I will tell you the difference. Continuous glucose monitors are prevent high blood sugar, low blood sugar. They help you motivate you, educate you to see what changes you need to make and really determine insulin doses. Where I have nothing against the finger sticks, but those are really episodic with finger sticks. You're only checking it when you feel symptoms or before you eat, but it does help you motivate you to make some changes. So there are different continuous glucose monitors out there. The Dexcom G6 is out there. That's an older one, but the G7 just came out, and so there's very limited application to it. It's indicated for 2 year olds and up. You wear it for 10 days, and it will give your blood sugar. It will give you your blood sugar readings every 5 minutes. The G7 for Dexcom is approved for pregnancy, diabetes and pregnancy, and gestational diabetes. It only has a 30-minute warm up versus a 2 hour warm up. And then there's Freestyle Libre. There you have Freestyle Libre 1, 2, and 3. You wear it for 14 days and it requires no calibration. Freestyle Libre 1, I use for a lot of my older patients because they're able to use a scanner if they don't have a smartphone. But all these technology you can use with your phone. And you wear it, this one on the back of your arm, where Dexcom, you wear on your belly. And these tools are really something to really help you better manage your diabetes. So You know, I have some slides to get through. I think I'm going to just breeze through my slides so I give enough time for Q&A. So, the first thing I want to ask you all is what about healthy eating to stay on target? And healthy eating can be so hard. It can be. There's so many temptations. And I think about Fridays. Fridays in my household was fried fish and fried potatoes. That's what we ate every single Friday. And even though my dad was living with diabetes, my aunt was living with diabetes, we all ate the same thing. There was one day everybody was like, all right, we need to get rid of the fried fish and let's try to have it baked. But healthy eating is something that is really important to incorporate every single day when you're preventing or managing your diabetes. And so, healthy food really kind of keeps your blood sugar on target. There are things that are less healthy, and what they will do will raise your blood sugar very fast and keep you really hungry. And so you'll see a hamburger, that's an old hamburger box, but you'll see a hamburger and french fries and even an apple pie. And then you'll see something more healthy where it has a sandwich and a piece of fruit and veggies. Now, that milk, I would say, that really, most people don't drink milk with a meal, but I know the reason why, and I'll tell you why they promoted milk really for overall health. And really was for blood pressure to help you lower your blood pressure. But eating healthy can help your blood sugar stay in target range, especially keeping your blood sugar less than 180 after you eat. And so I like to use this method for most of my patients. I want you to make sure that you have a half a plate of vegetables every single day. A quarter plate is your meat, and then a quarter of your starch. No matter what type of cuisine you like, you should make sure that you fill your plate this way. You'll be getting more fiber, you'll get enough protein to keep your blood sugar better, and then also you'll have some starch. Carbohydrates are not off limits when you're living with diabetes. We do realize you need carbohydrates for fuel, especially now, way you should eat it. You always eat your veggies first, then you move to the protein, and then you move to the starch. That will help prevent a blood sugar spike. So, our building blocks for good nutrition really are carbohydrates, protein, and fat. And I know people want to start on all types of diets. Our diets include, I hear out there from Atkins to doing meal replacements to Jenny Craig to even Weight Watchers. Some are better, that the ones that you can stay on for a long time. The ones that are short term are the ones that are really not sustainable. And you want to make sure those are the ones that you really decide to steer away from. You want to find something that you can make sure that you follow on every single day. But the key is having a wide variety of these nutrients to really keep you well, but also improve your blood sugar. And so carbohydrates, there are, I don't like to say good carbs and bad carbs, but they're better carbs for you and they're ones that are not so healthy. So the ones that are really good for you, it's like an umbrella. Carbohydrates are found in your fruit, your veggies, your grains, and your milk and your yogurt. They all have vitamins and minerals for you to be able to fight against. Right now, it's colds and flu season to fight against those things, but also to help you lower your blood pressure and also to keep your gut healthy. All these things are found in carbohydrates, but they're a good source of vitamins and minerals. Now, the ones that we need to stay away from. Now, I often have a sweet tooth only for like honey, and I love a sweet tea, but those are things I have to cut back on. I have a 40% chance of developing diabetes just because my father had diabetes. So these are the things that are really the things that you really try to take away out of your diet. So those are the things that have added sugar, also things like juices and sodas, and of course cakes, pies, and cookies. Those are occasional. They have a lot of empty calories and they do not supply the nutrients you need. And so you may say, well, how many carbs should I eat? And so typically for my ladies, I like to say if you're trying to lose weight, it's anywhere about 30 to 45 grams per meal. That's not per day, per meal. And if you want to maintain your weight, it's where 45 to 60 if you're really, really active. Now, active means you are doing about 20,000 steps a day. All right. It's not many people that are doing that. Very active are those individuals that are doing an hour, 2 hours plus of physical activity a day. And that's why you need more carbs. And so there is a little thing that I want to share with you. Most people think losing weight, I shouldn't eat. And there's a lot of intermittent fasting out there. I can't say that it's not, but I will tell you the people that actually eat more times actually are able to maintain and lose weight. So you want to make sure you eat on a regular basis. And I like to always say try to eat 3 meals a day. If you eat 3 meals a day, that is a great start. It allows you to really speed up your metabolism and also keep your blood sugar more stable. The longer you go without eating, the higher your blood sugar is. And I'll say it again. The longer you go without eating, the higher your blood sugar is. And the reason why is because your liver starts making more sugar to give your brain energy. So it is so important that you actually eat breakfast. That's called break the fast. You actually have to eat something so to prevent your liver from making more sugar. And so when we look at our labels, I always recommend for you to look at the labels for the serving size. That is how much we should really consume of that product. So the serving size here is a half a cup. And then I look at my total carbohydrates. My total carbohydrates 13. I don't look at the sugars because it's added together in the total carbohydrates. And so if I'm a lady and I'm trying to lose weight and I want about 30 to 45 grams per meal, I will then say, oh, I can have a half a cup of this. Now, if I want to eat a whole cup of that, I'm at 26 grams. If I want to eat a cup and a half of that, I need to start multiplying. But this is the way that you can use your label to help you better control your blood sugar. And there are also some other resources out there. There's Calorie King. There is a great resource. Now, I will tell you, MyFitnessPal. Some people like that. That resource oftentimes uses individuals entering in information, so the information may not be as reliable. I always say use your labels first. If you don't have a label, then you'll use a online resource. There are a lot of different apps out there too that can help you with label reading and understanding your portion sizes. So when we think about portion control, don't use your eyes all the time. Try to actually use tools. And so there's scales and measuring cups and spoons. These are things that you can use to really guide you, to help you with your portion size, to not only control your carbohydrate intake, but also your caloric intake. Now, we didn't really talk much about, we're really talking about carbohydrates and controlling your blood sugar if you're living with diabetes. Now, this also plays a part if you're preventing diabetes as well. And so I want you to make sure you start using your portion sizes to really help you cut your portion size down. Every decade, we actually have to have a negative 100 calories. If we're still eating like we're 18, guess what? We're going to put on the pounds over time. We have to make sure that we cut back our portion size. I used to laugh at my mom and my aunt. I call them the Golden Girls. They are 81 and 79. They live with me, and they used to always share a meal. And I didn't understand it. I was like, why do you share meals? And now I get it. Not only they saved on their their budget, but also it was allowing them to enjoy something but not eat up so many calories. And so fiber is really key. And for my ladies that are on here, fiber is also really key once you hit menopause as well. But fiber is key for also preventing and managing diabetes. And so we need to get at least 25 grams a day for ladies and 38 grams for men. I will tell you, fiber is the one thing that we're missing. Most Americans consume anywhere about 5 to 10 grams a day. And that is not enough to really help us prevent chronic disease, heart disease, certain cancers, and also diabetes. And so we got to make sure we eat more fiber. Now, I'm not telling you just to eat on bark, I'm telling you to eat foods that have more fiber. That's your fruits and your veggies. That is your grains, and that's beans and legumes. Sweet potatoes and even white potatoes are good too, long as you have the skin on them. And so we choose foods with lower in fat. This is the key for preventing diabetes. They actually recommend for when you have prediabetes that you lose at least 5 to 7% of your body weight, and then you are active at least 150 minutes a week. That's 20 minutes almost every day, or 30 minutes of physical activity 5 days a week. But the other thing is lowering your fat intake. So just mix and swaps. Instead of donuts all the time, try some yogurt and fruit. Instead of a burger and fries, you may try a sandwich. Oh, I love a good sandwich. I grew up outside of Philly, so we have hoagies. So we always had a deli, and that's where you actually have a lower amount of fat in that. And instead of ice cream, you may try a fresh fruit pop or frozen popsicle. Be smart and keep a grocery list. If you write the groceries list down, you can really plan your meals. Also, don't go when you're hungry because you know all those things will end up right in your cart. So be mindful of that and write down healthy things. I always say keep healthy things in the house. You will have no other choice but to eat them. And so when we're choosing menu options, we want to make sure we choose menu options that are baked and broiled, roasted, or grilled instead of fried. We choose tomato sauces instead of cream-based sauces. And we choose salads that have a vinaigrette versus creamy salads. And eat your veggies first. Veggies have really shown to really blunt that rise of your blood sugar. Choosing brown rice or baked potatoes or french fries or mashed potatoes, using broth based soups instead of cream based soups. These are just little things that you can do even when you go out to eat. We do enjoy eating out. And so when we eat out, we want to make sure we always choose water when we go out or coffee or tea and watch out for the added sugar. And when we go to fast food restaurants, there are some healthier options. No, they're not top on my list for you to go out and get fast food, but there are some healthier options when you want to go out and dine out. And so, looking for grilled chicken options, having an egg sandwich in the morning. I used to love an egg white delight. They took it off the menu, but egg white delight for McDonald's if I'm on the road, especially road trips. I would definitely pick that. And then when we have snacks, we want to make sure they are healthy. Choose more fruits and vegetables, things that actually live off of trees and you get from the ground versus things that have parents. We want to make sure that you eat more plants. Plants are really key to lowering your risk of chronic disease. And so when it comes to physical activity, I don't think that we give it enough credit. Physical activity alone, you heard, I'm seeing a lot of research on it now, that physical activity alone can improve your mental health, can lower your risk of Alzheimer's disease, can help you lose weight, lower your risk of heart disease, but also diabetes. You really get more energy. And so I have a watch on. This keeps me accountable. I joined a group on Pacer and we're doing a challenge. And so when they looked at those challenges, they realized that hunter gatherers, how we get to these steps, hunter gatherers actually had 20,000 steps a day. And so, somewhere in the middle of 10,000 steps. But if you're doing 3,000 steps or less, you are sedentary. We got to get you moving. Sedentary activity is one of the risk factors, especially in developing diabetes. So keep it fun. I love to dance, turn some music on. People are doing pickleball now. And even when the weather is a little bit nicer, you can get out in the garden. That is a part of physical activity. And so, what we usually like to follow is some principles. So, our principles really include making a healthy plate and having 3 meals a day. You want to make sure you choose healthy carbs and veggies always first, the veggie starter. I grew up where we always had a salad on the table. I didn't quite understand it, but now I get it. That salad was something there to not only give us fiber, but also it would give us the nutrients we need to actually prevent that blood sugar spike. You want to make sure you choose healthier carbs. So carbs are good for you. Don't live without them. A long distance runner would never go without their carbs. Be consistent. You want to make sure that you eat about the same amount of carbs for each and every meal. And be mindful, your hands are a good key to portion control. And so a palm of my hand is the size of whatever protein choice you have. My fist size is how much starch you should have, no more than that. And then you want to make sure I have 2 fists of veggies. You want to make sure when you go to the grocery store, shop on the outskirts. So when you first come in, it typically is the produce section. Your produce section should fill at least 60% of your cart. And then you go on around. Typically, it may be dairy or eggs, it may be cheese and milk. And then you come on around. You may then have you have your fish, and then you have protein sources, and then you may hit the bread aisle. But that's where you want to go. When you're going those inner aisles, you have to pull on those glasses, and you also then have to really start reading your labels. And when dining out, make sure you ask for a doggy bag right away. So you can divide that meal in half and then be able to sit and enjoy half that meal. It's half the calories, half the carbs. And then also, the choice should be water. There is one thing about A1C and blood sugar. Some things that we don't think about is dehydration. Dehydration can lead to higher blood sugars. And we do want to make sure that we get active. And even during these winter months where we can be pretty sad, seasonal, we can have seasonal affective disorder, we just don't want to get out. But it is so important for us to maintain our health even during the winter time. And so there are tons of resources out there for helping you better manage your diabetes and also living with diabetes and prevent diabetes. But a GRACE resource could be right nearby. It could be a registered dietitian, it could be a certified diabetes educator that really, really could help you better manage your diabetes. And so, with that being said, I want to make sure that you know diabetes can be controlled. You thrive when you're living with diabetes. And I understand nobody wants to have diabetes. We have not found a cure yet, but you can thrive with it and you are in control. You also are not alone. There are so many people that are living with diabetes, but also they have partners like myself, like the ADA, that really can help you with understanding the community of people living with diabetes. And find the right team. Everybody needs a team of people that are helping you stay well. And with that being said, I'm going to say thank you, but I'm here to really open up for questions and concerns. But I hope I was able to give you some just a little things that you can take away and also learn about diabetes.
Thank you so much, Angela. At this time, we are going to open up the chat for questions. You can also raise your hand and we will acknowledge you that way. And I do see we have one question in the chat. It says, is Metamucil recommended for diabetics as a way to get more fiber?
So, Metamucil, people can take Metamucil for diabetes. You do want to make sure that you check with your doctor if it's okay, especially if you have any gut issues or anything like that. I will say your body actually likes you to have a wide variety of fiber intake. And so, Metamucil is just psyllium. That's all it is. But if you have apples and pears and broccoli and cabbage. All those things actually are good for your microbiome. So they're doing a lot of research about the microbiome. Microbiome is what really is the key for our immune system. And also, they're looking at it to see how we are using that microbiome to prevent chronic disease. Now, your mother actually gives you your first start of your microbiome. So, how well your mother ate, and also if you had a vaginal delivery, will be the key to your microbiome. And so what happens is you have that genetic piece, but over time, what you actually put in your mouth to supply that microbiome can also predict your health outcomes. I don't know if anybody watches Netflix. I watch TV sometime. So they did a study out of Stanford regarding the twin study. They wanted to really see if a plant-based diet versus omnivore diet, basically eating meat, would affect how would it be effective with your microbiome, because we know your microbiome is really the key. And they found it was some good findings. So I'll let you watch it. I will tell you, the key is really being plant forward. Not for everybody doesn't have to be vegetarian or vegan, but just fill your plate with more plants. I teach seniors, and we do a back to basics, and we do a soil to table, and we talk about all the vegetables that their parents actually grew and used to fix. So I always think about my grandmother and her pickled beets. I mean, she had beets and we would pickle them. And that was not something we had. I mean, we just always had things around that we were pickling. And I think about it, a lot of the old principles that they did. So even my parents that had that salad on the table. But if you think about crudité before a meal, so even just pickles and even pickled carrots and those type of things on a table actually was very beneficial for us, because we even know the vinegar and that fermentation is actually good for our microbiome. So Metamucil can be used. However, I want you to eat real food.
Next question is, do you have to be overweight in order to be considered a diabetic?
You do not. I will say, so my grandfather was diagnosed at 86. He was very, very slim. He was active, so he walked 5 miles each and every day. Diabetes happened to him. And he didn't think, he was like, "What happened?" I said, "Pop up, you outlived your pancreas," basically. But what I would say is it can happen to anyone. The signs and symptoms of diabetes, though, are you're thirsty, you're urinating more often, you're tired, you may have a cut or a sore that doesn't heal well. For ladies, it may be a recurrent yeast infection that doesn't quite go away. These are signs and symptoms of diabetes. And just because you're slim does not mean you are not susceptible to developing diabetes. So you can still get it.
Okay, I see a hand. Angelina McCarthy Bryan, would you like to ask your question?
Thank you so much. Yes, thank you for your presentation. It has been wonderful. Thank you. I just wanted to know, what are your thoughts about intermittent fasting? Because I know you mentioned, having 3 meals a day is important, breaking that fast. But for some folks, intermittent fasting really works well. And if you have an active lifestyle. So what are your thoughts for folks that are possibly diabetic, is that something they should or should not consider? I'm just curious.
So intermittent fasting, they've done a lot of research on it. So in the field of diabetes, the evidence isn't quite there regarding managing your diabetes. The reason why is because of your liver. So what happens, most people when they're first diagnosed with diabetes or even pre-diabetes, they go on metformin. Metformin is a medication that will stop your liver from making so much sugar. But we know that the longer you go without eating, your liver will make sugar. And so the only way for your liver to stop making that sugar is to eat. So I find that some patients are successful with intermittent fasting depending on what type of medication they're on. So if they're on a medication that causes low blood sugar, so if you're taking, we like to say it's under a group of class called sulfonylureas. If you're taking sulfonylureas or you're taking insulin, going long without eating is not good. And also, I want to tell you something about fasting. I will tell you, if you feel these symptoms, it's considered a low blood sugar. If you're dizzy, if you're shaky, if you're irritable, if you're nauseated, if your heart starts to beat real fast, If you get a little confused, that means your body needs fuel. Those are signs of hypoglycemia. Now, there are people that use intermittent fasting for losing weight. And people can do that by just stop eating after a certain time. Think about it. People stopped and closed the kitchen at 6 o'clock or at 7 o'clock. We're eating all night. We're up all night eating. If we just stop eating, 8 o'clock, the kitchen closes. And guess what? That will be fasting, because if you stop eating at 8 and you wake up at 7 o'clock in the morning, guess what? You have been able to fast at least 12 hours. So I think it's just fancy words. Sometimes these wellness words get real fancy, but we just really need to just stop eating at a certain time at night.
Okay. Another question, does the same guidance and recommendations apply for pre-diabetics?
Yeah, I actually, so when you're living with prediabetes, I say, I want you to follow something like you were living with diabetes. And the reason why is because we want to prevent it. And so if I'm going to choose healthy eating, I don't want you to just turn healthy eating once you get diabetes. I want you to start eating healthy now because we want to prevent it. And like I said, it's at 5 to 10 years. But heart disease starts to set in when you have prediabetes. It's because the blood sugars start to rise and the fat particles start to really align against your lining of your arteries, making it sticky. And so it is time. It's time for you to eat well. It's time for you to exercise. And you need to treat exercise as your medicine. That 20 minutes every day or 30 minutes 5 days a week. And you'd be surprised just what exercise can do alone.
And actually, there was a follow-up to that. How does exercise impact glucose levels, and will it bring levels down substantially? I think you just
It
touched on.
does. It does. So I always ask my patients to do a test. I know you want to know, is it really worth it? Do I really got to do it? So you just check your blood sugar before you exercise and you check your blood sugar after you exercise. They have shown that it can drop anywhere from 50 to 100 points in blood sugar, especially after you eat. So you should actually do more movement after you eat. So my grandfather always had these little principles that he would tell me, and one was he always got active after meals. He would go for a small walk after a meal. And that was really something that people research now, but it was really simple. But that's what you do to better control your blood sugar. But exercise, if we could bottle it up, I would be a millionaire right now. The power of exercise really can really change your life. And I don't. You may get to that question about reversing, because I know people hear that word, reversing diabetes. Um, it can be reversed to go in remission. So I don't want to hurt anybody's feelings, but it can be reversed to go in remission. And what I mean by remission, it will always be there. If you go back to your old habits, the numbers just creep back up. So whatever you did in order for you to reverse it, you need to do it forever. You got to do it for a long time in order to make sure that it works. And exercise is one of those things. You got to do it. You got to make sure you stay active.
Okay, the next question is, can you comment about the tingling in feet and legs due to diabetes and what causes that?
So that is better known as neuropathy. Neuropathy is the nerve sensations that can be in your hands and your feet, but neuropathy can set in many different other places. It is a complication of that rise of your blood sugar. Now, I want to tell you, most of the time when people feel like their A1C is high, then these complications happen. But even when you have prediabetes, you can actually have neuropathy. And that issues with your nerve endings also happen in your sexual organs. And so for ladies, it's vaginal dryness. And for men, it's actually erectile dysfunction. But that neuropathy really can set in so many different other places. The way that we can improve it is better blood sugar control. But I will tell you, once you have a complication, all we can do is manage it. We can't reverse it. So it's not reversible. It really is to the point where you're managing it. But that's a complication of diabetes is neuropathy.
Okay. What advice would you give to those who have had to balance food restrictions and intolerances with diabetes prevention?
You need a good dietitian on your side. Somebody to really, really help you. You should not, Dr. Google should not be your end all to everything. I understand that social media gives a lot of great advice at times, but you actually need personalized, someone that really knows what they're talking about and can really help you design a meal plan for you. When you do have restrictions, so I'll just say, for example, I recently had a patient that we then put her on a FODMAP diet. That's for irritable bowel syndrome, and she was having a lot of issues, but she also is living with diabetes. When you're on a FODMAP diet, you're removing a lot of the things that you typically would eat when you have diabetes. And so, really, it was my job to really help her navigate that, to figure out, okay, what can we eat now? What is good for you now with all your restrictions? But you really should go to somebody. I would recommend that you go to somebody, and your insurance should cover it. We're doing a lot of advocacy around insurance should cover preventive measures. They want to cover you once you have something, but we want to make sure we help you beforehand. And so you really should go to somebody that can really help you with the meal plan for you with those different limitations.
Okay, the next question is, I see you mentioned liking honey, as do I. Would you recommend any healthy sweetener alternatives for hot tea daily?
Oh my gosh, it's really I do love honey. I don't know, maybe it runs in my family or something. They love sugar. They love sugar. But honey, sugar, raw sugar, sugar in the raw, they're all sugar. They all raise your blood sugar. Even agave. So a lot of people will choose agave, but it is similar to when you ingest it, it's similar to high fructose corn syrup. Your blood sugar actually rises pretty fast off of it. If you're living with diabetes, you have a couple options. You have the option to use a sugar substitute, but I know that there's a lot of information out there regarding sugar substitutes. There are ones that are healthier for you than others. So we start with the green pack. That would be that Truvia. And then we would move down to our yellow pack. Then we would move down to our blue pack. And then we do not use pink packs anymore. So I want to make sure if anybody's using the pink packs, please put them in the trash. And if you want to use a sweetener, you use it very sparingly. So I have patients that are living with diabetes and they don't use sugar substitutes because that's not what they enjoy. But if they were to have something, they use a very small amount of it. Um, and you can use a very small amount of, and that's it. If you have 1 cup of tea, I'm not going to beat you up with 1 cup of tea and 1 cube of sugar. That's not a problem. It's only 5 grams. I know how many carbs it is. It's only 10 calories. That's not a problem. But it's the liquid sugar. Like if you're drinking bottles of sweet tea or if you're having soda, those are the things that are the issue with those high fructose corn syrup. So I really don't have a solution for the honey. I just want you to cut back on it. So just make a small amount of it if you choose to use it and drink it with a meal. That would be the key if you're living with diabetes. Make sure you have it with a meal.
Okay. Are diabetic supplemental packets good to use?
So I think we're talking about sugar substitutes when they say supplements, or I just
Not
say
sure.
some
Maybe she
clarification.
will clarify that for us. Diabetic supplemental packs.
Like the
Okay,
vitamin packs.
the vitamin packs.
Yes. That are
Oh,
geared
okay, the vitamin packs. So there's only been really one, maybe two supplements that is typically recommended if depending on what type of medication you're taking. So if you're on metformin, we oftentimes recommend chromium or magnesium. We may even say a B12 because you may, because of the processing. Don't get fooled. Please don't get fooled. Everybody will put a label on it, say it's for diabetes, but they may not have anything special in it. A regular multivitamin, make sure you have vitamin D, and then you ask your doctor to do a panel. Now, this is a different panel for vitamins and minerals to see what you're actually missing, because some vitamins, remember, are excretable and some you actually store. And so water soluble vitamins are fine. They're not a problem. You can urinate the excess out. But when you are consuming chromium and magnesium, those minerals, they actually are stored. Zinc, you can take too much of it and you actually become sick. So my recommendation is a regular multivitamin, vitamin D, and then ask for a panel of your vitamin levels to see what you need. And that will give you exactly what you need. But don't be fooled by some of these labels. Um, they really, that's that wellness gimmicks that sometimes are out there because they want to make sure they prey on people when they are vulnerable. And so just be mindful of that.
Okay, and here is our reversal question. Is it true that you can reverse your HA1C numbers if you lose weight and your family has a history of AOD, adult onset diabetes? Or will you still have an increased risk due to it running in the family?
So you can. So the research that has been out there regarding weight loss and reversing diabetes. So I think this question is really about pre-diabetes or being at risk of diabetes. If you are overweight, and weight is subjective, I understand. I guess I brought up some controversial things. BMI, we don't look at BMI very often, but doctors still do. Um, but if you are overweight, that will put you at risk of diabetes. But I do want to tell you something. If you are overweight and active, you will have a lower risk of diabetes. If you're underweight and sedentary, you're putting yourself at risk. It really is the level of activity that you're doing. And so I would say if you build in healthy lifestyle and if I know I'm at risk, me and my sister are both are at risk. We need to do what we need to do. So we need to maintain our weight as much as possible, which it becomes challenging the older you get. That's guaranteed. It becomes more and more challenging. But the one thing we can do is be active. The people that are active, no matter how much they weigh, actually have a lower risk of developing diabetes.
What are your thoughts on new drugs such as Ozempic and Wegovy and their effect on diabetic patients? Do you recommend them?
I knew that was going to come up. Okay, so let me give you a really brief lesson on what these drugs are. Basically, it's in a category called GLP-1. It works on the gut, the liver, and the pancreas. It tells your gut to slow down the digestion, keep you fuller longer, sends signals to your brain saying you're full. It tells your liver stop making so much sugar and tells your pancreas to make insulin after you eat. All these drugs are replacing is a hormone that was already in your stomach. It is that same hormone that was in your stomach that really regulated your appetite. When you gain weight, you lose that hormone. So the more fat that you gain, you lose that hormone. So Ozempic, Wegovy, Trulicity, Mounjaro, Rybelsus, all of them can be effective. But the one thing I do want to tell you is your principle is still eating well. No matter where you are taking it, you will need more over time because your body will get used to it. And so the principles of eating well and exercising will always be there. There's nothing wrong with them. They do have some side effects that come along with them: nausea, upset stomach. And when you eat fattier foods, that's what causes the nausea. So if you're just eating whatever and taking your medicine that one day a week, you're going to feel sick. But I am worried as a provider on the back end, we don't know the long-term effects of them over time. Remember, these are new drugs. There are some drugs that we've known for years, that people have been taking for years. We know what can do. We don't know the long-term effects. The other thing that scares me is they keep on increasing more doses of it. And so we started off with a very small amount, 1.2, 1.8. Now we're up to 7 milligrams. And so I would just be on the air of caution. Yay, it does help. It really does help control appetite. It is a tool for treating diabetes, but you still have to eat well and exercise. Use it as a tool, just a tool, not your complete treatment. Just use it as one of the tools.
Okay. Is there a recommended amount of weight loss to eliminate diabetes medications?
It depends on how much weight you start off with. So the research they've really shown you is you can come off one pill if you lose up to 10 to 15% of your body weight. If you lose up to 20 to 30% of your body weight, you can come off of at least 2, 3, 4 pills. How they've done the research for this is weight loss surgery. So individuals have gotten sleeves versus gastric bypass surgery. We can see the percentage of body weight that they've lost and how much medication they were actually be able to come off. So losing weight is one of the things that can help if you are overweight or obese, having diabetes. But also the other caveat is, and you should talk to your doctor about it, is how long you've been living with diabetes. Because if you've been living it with diabetes for over 20 years, it may be hard for you to come off of medication. But if it's year 1 or year 2, you may have a good chance of really being able to come off that medication. But the only treatment we have seen to really have you come off medication is weight loss surgery, and especially Roux-en-Y gastric bypass surgery. And it's because of the malabsorption of the nutrients they have found to really help you eliminating your diabetes meds.
Someone asked, you mentioned earlier the 5-month diet. What is that?
So I was going to say there's a lot of fad diets out there. And when you are following a fad diet, that is something that you can only probably follow for a couple weeks or a month. You really should find a diet that is more sustainable and that really fits into your lifestyle. And so, whatever it is, you need to be able to stay on it for at least 6 to 8 weeks. If you can't stay on it that long or cannot afford to stay on it. So, I would like to say afford to stay on it because oftentimes people join weight loss programs. They are very, very successful. But once they stop getting the meals or not able to participate anymore, the weight they really comes right back on. So, you really have to find something that is really sustainable for you.
Okay, the next question is, what happens if one stops taking Ozempic?
Well, when you stop taking it, two things can happen. You will get your appetite back. You can start eating a little bit more. And if you have diabetes, you'll see that your blood sugars will rise. That's what happens when you stop taking it. So you really have to be. So I guess I want to say it like this. There are individuals that are taking Ozempic that are prescribed. There are individuals that are going to a nurse practitioner or going somewhere to a weight loss clinic and getting shots for the month. If you stop taking it, your results, you will regain some of that weight back. If you do not learn that exercise and eating well will really be your key. It does help and assist. I can't say, I mean, it does work. We've seen Oprah, okay? It does work. It works. However, what I will say is once you stop taking it, you then have to think about what principles you need to use in order to maintain it.
The next question is it better to switch to the Mediterranean diet to manage your A1Cs?
So, the Mediterranean diet has been shown to help you lower A1C, same as vegan and vegetarian has shown to lower A1C. I think Mediterranean diet is actually a very healthy diet. There's another diet that most people don't even know about. It is the African American Heritage Diet. Hmm. So it actually shows us foods from our diaspora, and they actually are in a pyramid, same as the Mediterranean diet, and that diet is just as effective. So and what the Mediterranean or the African American Heritage Diet does, it really the base is fruits and vegetables and leafy greens. That's where your base is. Then you move to legumes and tubers. So that's sweet potatoes, that's squash. Those are different things of that nature. And then beans. And then we have meat only occasionally. It's not every single meal. It is something that we have maybe once a day or every other day. And then milk is at the very top of the African American heritage. There's no milk. There's no milk, no dairy, and no sweets. So I will tell you, you can actually achieve improvement of your blood sugar following Mediterranean or even try the African American heritage diet.
All right, I see 3 more questions in the chat. How do snacks at night impact your fasting glucose in the morning? Should I be eating a protein and a good carb?
So, if I was your dietitian next door, I would ask, "Why are you eating a snack? Do you really need it?" And the reason why I would say that is because that's how sumo wrestlers gain their weight. They eat and sleep. And so, if you are not going to be up for an extended period of time, you may not need a snack. I do understand there's medication that you're concerned that your blood sugar will go low overnight and then before you need to eat a snack, you need to talk to your doctor. We can adjust the medication. And if you choose to have an evening snack, it needs to be, you need to eat at least 2 hours before you go to bed, and it should be a carbohydrate and a protein together. That combination together is what helps stabilize your blood sugar. So, I have to ask you the question, do you really need a snack?
Okay. What are your thoughts about gummy vitamins, as many of them are sugar-coated, such as prenatal gummies and some D3 vitamins as well? Are those sugars acceptable for people who are diabetic or pre-diabetic, or are those vitamins recommended mainly for people who are not diabetic?
So, I would prefer that you just had vitamins in the vitamin form. Oftentimes, the gummy vitamins, you do need to look at the back and see how much vitamin is actually in that gummy. If you are taking it and you are living with diabetes, your blood sugar will be affected by it because it has sugars in it. But I would want you to have it in a regular vitamin form, a pill form, a tablet form, versus having all those other extra additives to that vitamin. And look on that label. Sometimes you have to actually eat more of those gummies to get the recommended amount of vitamin needed. The RDA is the recommend daily allowance. That is not sometimes the amount of vitamins you need to actually prevent or manage a condition. It's just the amount for you to be able to, we like to say, survive. So just look at that.
And the last question I see in the chat is, as a pre-diabetic, there are times I will overindulge with sweets. However, I'm exercising 4 to 5 days a week, long walks, runs, high cardio, and my numbers are slightly elevated from the previous blood test results.
So I think this is about your sweet tooth. So I want to ask you, when you're eating sweets, how do you really feel? We eat things for our emotions often. We eat things because we're bored, mad, sad, lonely. We choose things that are often comforting. And so, when you're choosing to eat those things, you need to recognize, am I hungry? So, asking from our belly, am I hungry or am I hungry? And I was pointing to my head because oftentimes that is considered mindless eating. If you do like a sweet treat, make yourself a goal. So, goals can be having it every other day. It could be also having it once a week. It could be having a smaller portion or saying, I'm going to try something different for my sweet treat. I would encourage everybody to choose fruit as dessert. I know it's not always, and we just passed the holidays. My aunt loves to bake. That she loves to bake sweets. But I will tell you, the portion size matter and how often yet you eat it. Sweets also have fat added to them. So we oftentimes think that only the sugar is raising our blood sugar, but the more things that have fat as well, over time creates more of an inflammation, and that inflammation can raise your blood sugar over time. So for my sweet treat eater, just ask yourself, am I really hungry? And what are some things I can do to cut back on my sweets?
Okay, one more. Is monk fruit sweetener good for diabetics?
You can use monk fruit. I know I totally forgot about that one. I don't always think about that one, but you can use monk fruit. That is an acceptable sweetener to use. There are sweeteners, I want to tell you, that have approval for, we call it grass level. That means they are approval for tabletop. And some sweeteners are better known as supplements. Supplements, I want to tell you, are not FDA approved, so they do not go through regulation. So what they may say they have in the package doesn't mean it's necessarily in the package. So that's why you have to be really mindful of your supplements that you take. How would you use monk fruit? Just you can sprinkle it on some sugar. Sprinkle on some cereal if you want, or berries if you want. You can use it in those different ways. You can also stir it in your coffee or tea. People use monk fruit in different ways.
Okay. Angela, we would like to thank you so much for the information you've shared tonight. I am now going to turn it over to our chapter president, Ms. Helene Fisher, so she can give us our last closing remarks.
Wonderful. Thank you. All right. Our Physical and Mental Health Committee selected the perfect title or theme for tonight's event, Diabetes, Your Questions Answered. And we thank all of you for engaging and asking your questions. And it is our sincere hope that you have more insight into finding your sweet spot with diabetes and increasing your healthy habits to support healthy living. We are very, very grateful to have Angela Jen Meadow with us this evening. Everything you shared with us tonight was helpful, practical, things we can visualize and remember to do. So thank you so much for explaining so many different things in plain and simple terms. We want to thank our Physical and Mental Health Committee of the Fairfax County Alumni Chapter that's led by Mrs. Nikita Carter. And we thank you for calling this important topic to our attention. We want to thank our participants for joining us today. We truly appreciate your participation, especially on a Friday evening that you could be doing so many other things. but we hope this session was very insightful for you. I don't know if we have a survey this evening or not. We do?
We do, and it is in the chat. So if everyone could please click on that evaluation link and fill that out for us. And if you have not signed in, we put that back in the chat as well. Please sign in for us so that we can take attendance.
Wonderful, wonderful. So please don't forget to fill out that survey. Your responses actually help us focus on the execution and effectiveness of our programs. And we need to know what resonates with you. I don't know if I see that link for the survey, so let's make sure that we put that up there. Tonight's discussion will be posted on YouTube, on our YouTube channel, so look for us there. And on other social media platforms is Fairfax County Alumni Chapter of Delta Sigma Theta. And you can also visit us on our website at fcacdst.org. With that, we'll hold for a couple of minutes so that we can make sure that the evaluation link gets posted. And we would like to, again, thank you for your participation, and may you live well with healthy living. Good night, everyone.